As you've watched this play out all week long, Scott, what have your thoughts been on what both sides have been saying? They're far apart on what they think that the Woodward book indicates from the tapes. The president on tape saying that he had downplayed it for a reason, to prevent panic.
Yeah, well, look, I think that there was reassuring messages coming out of the administration. And it wasn't just the president. I mean, when you look at health officials as well, especially the politically appointed health officials, they were issuing reassuring messages over the month of February. And that's really the month that I would focus on, because I think by March there was more warnings coming out of the government and a more sober analysis. And the question is, if there was a more sober analysis coming out in February, would we have done things differently? Would we have implemented more vigilant measures to try to spot and control the spread that was clearly happening in American cities? And I think the reality is, over that month, and I had many discussions with White House staff over that time period, the White House staff was being told by a lot of the health leaders in the administration that the virus wasn't spreading here, that they were very confident that there was no spread in the United States. They were using the influenza-like illness surveillance network, basically a network that tries to track people who are presenting with flu-like symptoms to certain healthcare locations, particularly hospitals, emergency rooms. And they weren't seeing any uptick in that data. And they assumed that because there was no uptick in that data, therefore coronavirus couldn't be spreading in the U.S. And what we now know in retrospect was this was spreading. And we know the influenza-like illness surveillance network was very insensitive for detecting that spread, because coronavirus doesn't present like the flu in many cases. And so they were getting very reassuring messages from health officials. I was having pretty detailed discussions with them over that time period, over that whole month, and hearing back from them that they were pushing the health officials, the political folks in the White House, the policy people who weren't health people, and were being told that it wasn't spreading in the United States. And so I suspect that some of the president's comments, just to put it in perspective, reflected that he was being told that it wasn't here in the U.S. yet.
I'm not going to disagree with you about February. I think that there was lots of misinformation inside the White House by many of the professionals who may not have fully understood the impact and where things were headed. The question, though, and I'm actually even surprised that you would focus on February, is where the president's mind was in the administration on March 19th, which is when he made the comment that he purposely was downplaying the virus. And that was a very different time. And purposely downplaying it in March at that point had a huge impact in terms of masking. And again, I know there was a big debate about whether there was enough masks and what they should be telling the public about social distancing. Take New York out of it, and I think New York got the brunt of it early, in part because a lot of these things were not known. But by March 19th, a lot more was known, and you had then the rallies that the president was pursuing, and so many other things. The things that the president was doing relative to the things that you were saying on air were almost at complete odds. Though I know you've taken you're very careful with your words.
Well, look, the statements out of the administration have been a mixed bag. There's no question about that. I think on March 19th, I saw that comment in the book. I don't know what time period the president's referring to when he made that comment, but remember, on March 16th, they announced the 15 days to slow the spread. So they actually had taken pretty aggressive steps by that point to implement mitigation. So they were taking it seriously. And I had a conversation with the president around that time period. You know, the White House, the mood had clearly changed inside the White House and in and around the president. So that's why I'm focused more on what was happening in February, because to me that's really the critical time frame when we could have done more to mitigate the spread and not have gotten ourselves into the situation in March that we had to then reach for the stay-at-home orders, which had the devastating impact on the economy. So that's why I tend to focus on what was happening over February and what was being said over February. I think by March, whether the White House was or was not saying certain things, recommending masks by that point, most of the general public was aware, and most of the political leadership in the country and the governors were, echoing a much different message at that point. And so the country was becoming more sober to the looming threat.
Doctor, I would just take issue with that, because I think while that was perhaps true in places like New York that were clearly getting hit, in large parts of the country, in Texas, in Florida, in so many other places in California that ultimately did get hit, it was as if nothing had happened. And in part, there was because of, I would argue, to some degree, at least some of the messaging out of Washington. You don't agree with that?
No, I think that that's fair. And look, we were very late. I had talked about on this show the idea of the masks and recommending masks more widely. We were very late to sort of implement that. And I think that some of the mixed messaging and some of the messages that downplay the risk, and look, it came from the president too. I'm not denying that. I'm cognizant of what he said over that time period. Really hardened a view among some people in the country that this was a diminished threat. And I think it's very hard to unring that bell. I think there are people who have a view on this, and it's not going to change. And their view, unfortunately, is one of too much complacency. So they're not taking simple steps that could help reduce their risk.
Right.